I'm Bob Hallmark in Longview. I am in studio today. Let's talk about medical studies. They go on all across America every day, and it's all in the effort to increase knowledge and research in just about every medical field. And one of those studies is going to be done right here in Longview. Now, to explain, we're joined now by Dr. Scherezade Mama at MD Anderson Hospital, and she is going to explain a little bit about this study that's going to be taking place here. Good morning, doctor.
Good morning.
Okay, tell us a little bit about what is this study that's about to happen. I understand it's called Harmony and Health. Is that right?
That's right. So Harmony in Health is a study to understand how well, first of all, it's a study to reduce cancer risk by increasing movement in adults who are sedentary or insufficiently active and are at greater risk for cancer. We primarily focus on Black and African American adults who live in the Longview area, largely because cancer rates are higher in Northeast Texas and among Black and African American adults, and so is mortality. So Black and African American adults are also more likely to, not only more likely to develop certain diseases, but then also die from those diseases. And so that's why the focus in this Northeast Texas area and on this particular population. In Harmony and Health, we're just trying to get people to move more and sit less, and simultaneously doing it in a fun way that we can also address psychosocial well-being and maybe reduce stress in this population. So that's the overall goal of this study, to better understand how movement behaviors and health education related to cancer risk and cancer prevention can help improve the health of people in the Longview area.
Okay, you just answered my second question, which was how was Longview selected? In the never-ending effort to beat cancer, and it's been 60 years of research and effort and fundraising and things of that nature. I guess every possible variable has to be examined to determine, because we still don't have the ultimate answer of, how to prevent or cure cancer.
Correct. Yep, you're absolutely right. I mean, we don't know how we can prevent cancer. Cancer is a disease of the aging, right? So as our population lives longer and longer, more and more people are going to develop cancer. But we've made a lot of advancements in cancer prevention as it relates to health behaviors. So things like being more physically active, eating a healthy or plant-forward diet, right? Limiting your intake of red meats, smoking, quit smoking, right? Reduce your alcohol consumption, wear sunscreen. Some of these kind of basic behaviors we probably learned about along the way and heard throughout our lives, right? But that actually make a big impact. So physical activity alone can reduce your risk of cancer by almost 50% for certain cancers, right? I don't think a lot of people know that. And then once you develop a cancer diagnosis, being more physically active or adopting a physical activity routine can reduce your risk for recurrence, right? And so I think these are messages, like, we've done a lot of research. We don't yet know how to 100% prevent cancer, right? Nor can we in everybody. But I think some of these little steps can help us along the way.
You just mentioned something I think is important to note here. The success rate now compared to, let's say, 60 years ago, a word that's used now very often by cancer patients is remission. And that's very important to note, that it is because of all the research over the past 60 years that we have the techniques now that give people a second chance and maybe even a second and third chance at beating cancer and go into remission.
Yeah, 100%. I feel like, we are so much more, like, we are so much closer to using the word cure, right, than we've ever been before. It's frowned upon to say that, right, because cancer goes into remission, but it has a high likelihood of recurrence for certain cancers. But we are so much closer to a cure than we've ever been before. And, in MD Anderson's motto is we want to make cancer history, right? And end it. And so I think we're closer than we've ever been. Some of this prevention research related to prevention is part of the reason. And some of it is also in treatment related advancements we've made. We're just better at diagnosing, catching cancer early. That's one of the things. Catching it early in early stages and then treating it aggressively, I think, is where we've made a lot of progress in our field.
One of the variables also is that we live longer. Americans live longer now. And I'm guessing that's one of the reasons why we're doing this study. First of all, how is this going to be conducted now? I understand we're going to have a number of individuals that we need for
Yep.
the study.
That's right. So we're looking for 50 adults in the Longview area. Again, I mentioned insufficiently active and at greater risk for cancer who are willing to come in. We're holding sessions at Broughton Recreation Center on Tuesday and Thursday evenings, so twice a week for 8 weeks. Participants would complete, if they're interested, they would contact our team. They'd briefly be screened for eligibility. Then we'd bring them in to do a quick assessment. It's just a baseline assessment. We do some basic physical health assessment and then some questionnaires. And then they are randomized, which means they're randomly selected with a flip of a coin to participate in the study in one of two groups. In one of the groups, they'll do more movement. In the other group, they'll learn more about cancer prevention behaviors and other things related to cancer prevention. Both groups meet twice a week for 8 weeks. At the end of the 8 weeks, we bring them back in, do another quick assessment, and that's it. We follow them for another 4 months, 6 months for whatever reason. And behavioral science is kind of like the magic number, right? If we can get people to adhere to a behavior or a lifestyle change for 6 months, we think we've solved the problem, right? And so we'll follow them, see if they can maintain some of the changes we're seeing for 6 months. But that's it. Participants are compensated for their time and effort in the study, so they receive a gift card at each of the assessments, plus we give them some small gifts throughout the program.
Okay. We're in the initial stages of it right now, so I'm guessing we anticipate that the study will begin, I'm guessing
February.
sometime in the near future here.
That's right. We're hoping to start February 17th. So we're looking to enroll people before that date. So if people are interested, I'd encourage them to contact our team.
Finally, the ultimate goal here for any study is to gain more knowledge of how best to treat and to diagnose and things of that nature. The ultimate goal, as with any doctor who works in this field, is to put yourself out of work, is to beat cancer.
That's right. You're absolutely right. Our goal is to learn more about how we can prevent behaviors, what are some successful strategies, and ultimately reduce people's risk for cancer and improve their overall health and well-being. So yes, my goal is to no longer be employed.
Well, then you would just shift to another area, I'm guessing.
There'll always be something, right?
Okay. All right. Well, thank you for joining us this morning. If there's anything that we have neglected to ask here, I would go ahead and open it up at this point. But obviously, you're very optimistic at this point that this could be a very, very useful study here.
Yes, that's our goal, to improve the health of residents in Longview, and bring, some cutting edge novel cancer prevention strategies to the area.
All right. Doctor, thank you so much for joining us.
Thank you.
All right. And we will have much more on this story tonight on KLTV 7 News. For KLTV Web Extra, I'm Bob Hallmark.